The story opens in a hospital emergency setting where consultant surgeon Elizabeth Taylor and her registrar Richard Whitehead are called to treat Lisa Williams, a critically ill young woman. Lisa presents with tachycardia, elevated pulse, increased respiration at 22, and dropping blood pressure. She's been given morphine and Maxilon for pain management. Richard provides the medical history. Lisa had been experiencing cramping abdominal pain for 1 day, with tenderness and guarding at the left iliac region. She was initially given trimethoprim, diclofenac, and paracetamol, then sent home. 3 days later, she returned in severe pain with an elevated pulse and was put on IV fluids before being transferred to their hospital. She's had decreased urine output for 2 days, and imaging suggests possible bowel involvement with an IUCD, intrauterine contraceptive device, in situ. Elizabeth quickly diagnoses an intra-abdominal catastrophe requiring immediate surgery. The radiology suggests necrosis of the bowel and abscess not amenable to percutaneous drainage. They prepare for urgent laparoscopy with 3 units of packed red blood cells cross-matched and call Dr. Colton to consent the patient.
The surgery begins using the Hassan technique with Elizabeth leading, Richard assisting, and Robin as the surgical nurse. Alex serves as the anesthetist and Maylen operates the gas insufflation equipment. Elizabeth makes a 10mm incision above the umbilicus, working through subcutaneous tissue into the fascia using Kucher forceps and S-bends. They successfully penetrate the peritoneum and begin inserting trocars. Elizabeth plans to insert 3 trocars total and begins gas insufflation to separate the organs for safer instrument insertion. However, problems arise with gas pressure and flow. Elizabeth requests 10 units of pressure, but they're not achieving adequate flow rate despite the tank being full. When they discover extensive pus indicating sepsis, Elizabeth proceeds with inserting the second trocar under direct visualization. She then asks Richard to insert the final trocar. Despite concerns about gas pressure, Elizabeth encourages Richard to proceed, telling him he has plenty of room and urging him to give it some welly when the trocar initially fails to penetrate. The trocar insertion goes catastrophically wrong, causing massive internal bleeding. Elizabeth immediately calls for conversion to open surgery, demanding the B-tray and arterial instruments. The heart rate spikes to 160 and systolic pressure drops to 90 as torrential bleeding begins. Elizabeth takes control of the emergency, working frantically to identify and control multiple bleeding sources. They discovered tears in the inferior vena cava and damage to the lumbar artery. Richard applies finger pressure to control posterior bleeding, while Elizabeth works to clamp and suture the damaged vessels using 5-0 Prolene sutures. After controlling the life-threatening hemorrhage, Elizabeth completes the original operation, washing out the pelvis, inserting a drain, and removing the appendix. The surgery concludes with Lisa stabilized but having suffered significant trauma beyond the original sepsis.
Following surgery, Elizabeth briefly checks on Lisa in recovery, where Nurse Jan is monitoring her breathing and managing her agitation about the oxygen mask. Elizabeth reassures Lisa that the operation went well before leaving to reschedule her next surgery due to the extended operation time. However, Lisa's condition deteriorates overnight in the intensive care unit. Despite the surgical repairs, the advanced sepsis proves overwhelming for her system. She experiences respiratory distress, becomes agitated and anxious, and ultimately goes into cardiac arrest during intubation attempts. The ICU team, led by Dr. Ben Matthews with Nurse Jan, works for 30 minutes trying to resuscitate her, but Lisa is pronounced dead at 4:48 a.m. She was 29 years old. Elizabeth learns of Lisa's death via text message while walking to work the next morning. When Richard asks how she heard, Elizabeth explains that Lisa was likely never going to survive due to the advanced sepsis, though she acknowledges that the surgical complications certainly didn't help and may have contributed to the outcome. Hospital Administrator Andrew McGrath informs Elizabeth that Lisa's family wants to meet with her. They're very distraught and feel caught off guard by Lisa's death, having been told the surgery went well. They expected something routine like appendicitis and are unsatisfied with the explanation from ICU. The family met with intensivist Dr. Ben Matthews, but they specifically want to speak with the surgeon. Elizabeth meets with Lisa's parents in the Wano room to explain what happened. She describes how Lisa was very sick with infected reproductive organs, likely caused by her IUCD. She explains the laparoscopy procedure and how they discovered extensive infection requiring immediate intervention. When pressed for details about complications, Elizabeth admits there was a complication during surgery that required a larger incision than initially planned. She explains that Lisa was moved to intensive care after surgery, where the infection proved too much for her body to handle, leading to breathing problems and cardiac arrest. The family struggles to understand, having expected a simple appendectomy operation. They're devastated to learn their daughter is in the morgue, and Lisa's father angrily photographs Elizabeth, demanding to know her name. The meeting ends with the family's grief and anger unresolved. Andrew McGrath warns Elizabeth about a surgical conference on surgical safety and measurements, where surgical outcomes will be published publicly. This transparency initiative will expose every surgeon's mortality rates and complications, potentially ending careers and discouraging treatment of high-risk patients. At the morbidity and mortality meeting to discuss Lisa's case, Elizabeth argues it's incomplete without ICU representation, since Lisa died under intensive care. However, Andrew insists on focusing on surgical complications, noting that the family has questions specifically about surgical errors. During the meeting, the surgical team reviews the procedure step by step. Robin, the surgical nurse, confirms that Elizabeth verbalized concerns about insufficient gas flow during insufflation. The discussion reveals that there's no definitive gauge measuring actual abdominal pressure, only flow rate indicators showing whether inflation is adequate. Elizabeth initially takes responsibility as the lead surgeon, but then reveals that Richard actually inserted the problematic trocar under her direct instruction. She admits telling him to give it some welly when it wouldn't penetrate, leading to the catastrophic vascular damage, including tears in the inferior vena cava, posterior abdominal wall, and lumbar artery. Meanwhile, Elizabeth's personal life shows strain. Her friend Jessica asks her to take care of her dog Atticus during her divorce proceedings. Despite Elizabeth's reluctance due to never being home, Jessica persuades her by describing Atticus as old, house-trained, and low maintenance. Elizabeth's relationship with surgical nurse Robin becomes complicated as they navigate both professional and personal boundaries. Robin expresses concern about Elizabeth's ability to protect her career if things go wrong, and their relationship becomes increasingly strained under the pressure of the investigation. Elizabeth also attends the surgical conference where speaker Tess discusses the implications of public reporting of surgical outcomes. Elizabeth strongly challenges the policy, arguing it will force surgeons to avoid sick patients and negatively impact training opportunities. She points out that only 29 cardiac surgeons serve the entire country, and the new policy could force many into early retirement. Elizabeth receives official notification that her laparoscopic and laparotomy privileges have been temporarily suspended pending investigation. The formal complaint from Lisa's family has escalated into a serious professional matter, threatening her surgical career. Richard struggles severely with guilt over his role in Lisa's death, calling Elizabeth to express his distress. He reveals he's been having nightmares about Lisa and feels responsible for her death. Despite Elizabeth's attempts to reassure him that she bears ultimate responsibility as the supervising surgeon, Richard cannot overcome his guilt. Richard mentions that his father has just been appointed head of surgery in Dunedin, making him reluctant to discuss the situation at home. He expresses uncertainty about whether he's capable of being a surgeon, questioning his competence and judgment. Elizabeth offers to arrange confidential counseling for Richard and repeatedly emphasizes that the decision to proceed with the trocar insertion was hers, not his. She insists that training inherently involves risks and that she chose to trust his judgment in a learning situation. In a subplot that mirrors the main tragedy, Elizabeth accidentally leaves Jessica's dog Atticus locked in her car on a hot day. When she discovers him, he's severely overheated and near death. She rushes him to a veterinary clinic, but it's too late to save him. The veterinarian explains that Atticus needs to be euthanized due to heat stroke. Elizabeth, devastated by her negligence, stays with the dog as he's put to sleep. When Jessica arrives, she's heartbroken and furious, screaming, "You killed my dog!" at Elizabeth. This incident compounds Elizabeth's guilt and sense of responsibility for the deaths and suffering around her. The parallel between her mistake with the dog and the surgical error becomes another weight on her conscience. The cumulative pressure proves too much for Richard. Elizabeth discovers him dead in his apartment from what appears to be a drug overdose. She finds his body and is devastated by the loss of her young colleague, feeling responsible for his death as well as Lisa's. Elizabeth calls emergency services and becomes the first responder to Richard's suicide. The discovery traumatizes her further as she realizes that her failure to adequately support Richard or take clear responsibility from the beginning contributed to his death. Andrew McGrath immediately moves to control the narrative around Richard's suicide. He characterizes it as burnout rather than guilt over the surgical complication, attempting to distance the hospital from responsibility. Andrew outlines a plan to publish an article in the New Zealand Journal of Medicine portraying Richard as young, inexperienced, and out of his depth, essentially scapegoating him to protect the institution. The hospital plans to provide staff counseling and hold a memorial vigil, then return to business as usual. Andrew explicitly asks Elizabeth to sign off on this version of events, comparing the process to maggots cleaning wounds, necessary but unpleasant. Elizabeth meets with Dr. Ben Matthews and Nurse Jan from the ICU to understand exactly what happened to Lisa after surgery. They describe Lisa's final hours. She was anxious and agitated, complained of being cold and tired, had rapid breathing and declining vital signs. The ICU team intubated her when she went into respiratory distress, but she arrested during the procedure and couldn't be resuscitated despite 30 minutes of effort. Jan confirms that Lisa wasn't alone at the end. Her family was present until the intubation, and Jan stayed with her throughout the night. This provides some comfort that Lisa received caring attention in her final hours. At Richard's memorial service, Andrew gives a carefully crafted speech presenting the official narrative. He describes Richard's death as the result of burnout while working with accomplished surgeon Elizabeth Taylor. He announces new mental health initiatives and emphasizes teamwork and community support. However, Elizabeth interrupts the ceremony to set the record straight. She publicly contradicts Andrew's sanitized version, stating that Richard didn't die from burnout, but committed suicide after overdosing alone in a garage. She takes full responsibility for both Lisa's death and Richard's suicide. Elizabeth explains that Richard was a 26-year-old student doctor who followed her instructions and didn't deserve to carry blame for her mistake. She admits telling him to push harder with the trocar and choosing the timing and words that led to the complication. She refuses to allow the hospital to scapegoat Richard or misrepresent his death. Her speech emphasizes the covenants healthcare workers have both to patients and to each other, arguing that both are being broken by the hospital's handling of the situation. She declares she won't stand by while middle managers and bureaucrats pretend otherwise. In the story's conclusion, Elizabeth meets with Lisa's parents one final time to provide complete honesty about what happened. She acknowledges that while the surgical error certainly didn't help Lisa's condition, the advanced sepsis would likely have been fatal regardless of the complication. Elizabeth admits she would make the same surgical decisions again if faced with the identical situation, as they were all made attempting to save Lisa's life. However, she takes responsibility for not being clearer about her role from the beginning and for allowing doubt to affect Richard. She emphasizes that Lisa fought hard against the infection and was genuinely cared for by the medical team. Elizabeth expresses her sincere sorrow for the family's devastating loss while maintaining honesty about the medical realities they faced.